Hello everyone, hi, Dr. Hatta here again. Today, me and Dr. Chong will be talking about another condition. Hi, Dr. Chong.
Hello,
Another
everyone.
another condition which may affect our fertility, which is called pelvic inflammatory diseases. Okay, Dr. Chong, maybe you can explain to us what does pelvic inflammatory diseases means.
Okay, pelvic inflammatory disease, or PID for short, is infection of the female reproductive organs, and it occurs when sexually transmitted bacteria spread from the vagina to the uterus, fallopian tubes, and ovaries. What are the symptoms? The common symptoms can be abnormal vaginal discharge with abnormal color, abnormal smell, and sometimes women can have lower abdominal pain, discomfort, or even fever during the acute attack. Sometimes they also complain of pain during sexual intercourse, bleeding during sex, and bleeding in between periods. But a lot of the times, many have very subtle or mild symptoms, and some even have no symptoms at all. And one of the long-term complication is scarring and blockage of the fallopian tube. And the thing is, if a lot of people have no symptoms, which means if you don't check your tubes, you wouldn't know if they are blocked or not. And today I'm going to focus more on the problem of blocked tubes. And in fact, checking the fallopian tubes is part of the routine fertility investigations we perform for our ladies. There are several ways of checking it. The commonly used methods are X-ray, which is called the HSG, which stands for hysterosalpingogram. We can also check the tubes by ultrasound means, HICOR-C, hysterosalpingo-contrast sonography. So these two methods involve injecting some contrast agent into the uterus and looking at the X-ray images and ultrasound images. We will see the flow of the contrast agent through the tube, and this is how we can diagnose whether the tubes are blocked or patent. There's another method which is through the laparoscopic surgery, but as we know, surgery is always invasive, so we will still prefer the first two methods unless the lady also has some other pathology, for example, ovarian cyst. Then we will choose laparoscopic surgery because we can deal with two things at one setting. We can check their tubes and we can also remove their ovarian cyst at the same sitting. And now I want to introduce this word to you, which is hydrosalpinx. Hydro means water, salpinx means tube. It means there is water or fluid collection in the fallopian tube. And if we do a standard transvaginal ultrasound scan, meaning without any injection of a contrast agent, we cannot detect blocked tubes when they are just purely blocked but without fluid collection. But if there is a hydrosalpinx, if there's fluid collection, it will appear like an elongated, swollen structures, looks like a sausage. So hydrosalpinx can be detected quite easily through the standard transvaginal ultrasound scan. And talking about problems of blocked tubes and infertility and how to help these women to get pregnant, Dr. Hatta, can you explain to us about these topics now?
Yes, thank you very much, Dr. Chong. Certainly, if someone has pelvic inflammatory disease, like Dr. Chong explained, it can lead to complication, which includes blockages of the fallopian tube. As you know, fallopian tube is where the egg and the sperm meet and fertilization occurs. So imagine if there's a blockage of the tube, the egg and the sperm will not be able to fertilize, to meet and fertilize. Now, as Dr. Chong had mentioned before, blockages is due to scarring, and this can lead to other complications, which includes hydrosalpinx. If your tube, one of your tube, you have two tubes, two fallopian tubes, left and right. If one of the tube is blocked, but the other is a patent or not blocked by evidence of HSG, like what has mentioned before, then you have a chance of conceiving, even conceiving naturally, provided that the egg which comes out from that particular month comes out from the side of the tube which is not blocked. You can increase your chance of pregnancy also by doing IUI if you have one blocked tube. However, if you do have both of your tubes are blocked, both tubes are not patent, both tubes are scarred, and then there is no other way of conceiving except for doing IVF. Because IVF is where we do fertilization in vitro, means outside the body. And once the embryo is formed, we put it back into the uterus. However, like Dr. Chong did mention, if you do have hydrosalpinx, it is advisable before doing the IVF is to we should remove the hydrosalpinx tube, because a tube which is swollen has contained toxins inside it, which is toxic to the embryo, especially when we do the IVF, when we put back the embryo inside the uterus, that toxin in the hydrosalpinx may kill off the embryos which was placed back into the uterus. So it is advisable that we do a salpingectomy. That means a removal of the fallopian, the hydrosalpinx fallopian tubes before doing the IVF. And of course, IVF is one of the, I would say, the only method of the treatment if you do have both damaged tubes. Isn't it, Dr. Chang?
Yes, definitely.
Yeah.
Maybe I just add a few words of encouragement. In fact, women with tubal factor only, which means they have actually no problems with the egg and sperm quality, but they can't get pregnant because of blocked tubes, you stand a very good chance of getting pregnant. I know some women, they feel very worried, especially those with both hydrosalpinx, both tubes are swollen with fluid. When I tell them you have to have both tubes removed, they got very worried. But don't worry, because after removal, you have a very good chance of getting pregnant with IVF. So please feel positive about it.
Yes, definitely. If just tubal factor is the factor of infertility, they have a good chance provided they are still young and no other co-factors along the way. Okay. I think that's all for today. Thank you very much again, Dr. Chong, for enlightening us.
Thank you for watching.
Thank you for watching, everyone. We hope that to see you again soon with other topics in the future. But for now, I bid you goodbye.
Goodbye, everyone.
Bye, everyone.